Today is the official launch of a directed campaign by Voices for Non-Opioid Choices. The coalition of organizations is working to prevent opioid addiction and increase awareness about non-opioid pain management. The launch follows the latest round of lawsuits against Big Pharma.
So just this week, Pennsylvania's Attorney General announced legal action against Purdue Pharma. They allege that the company misrepresented its opioid products as non-addictive and appropriate for chronic pain when they were, in fact, addictive and inappropriate for chronic pain. Here to discuss how Voices will help patients and families dealing with addiction is Courtney Hunter. She is the Director of Advocacy and Government Affairs for the Center on Addiction. Courtney, welcome.
Thank you so much for having me today.
Tell us about this launch today. What's the plan?
Voices for Non-Opioid Choices Coalition. We are so excited to come together today. We're a group of advocacy organizations, patient provider groups, legislators that are coming together to advance the mission of having access to non-opioid alternatives. There's 130 Americans every day that are dying from an opioid overdose. This is preventable. In the acute pain setting, there's 3 million Americans that get dependent every year on opioids when we have these other alternatives available to us. So we're really excited for all of these organizations to come together and to help advance this mission and also educate people about the alternatives that exist.
So I've been hearing talk like this for years and years, but it seems that everything is just getting worse. Why is dramatic action not being taken? I mean, and realistically, what dramatic action needs to be taken? Does there need to be a ruling by CDC or the CMS or FDA or whomever and just saying this is how we prescribe opioids now?
Yeah. Well, the CDC has issued official guidance on prescribing opioids. There's no silver bullet to solving this crisis. We need a comprehensive approach. Non-opioid alternatives are one of those tools in the toolbox. That's really important. But we also need more money. We need more funding for this. At the Center on Addiction, where I work, we are committed to helping family members. We think about addiction like the disease of Alzheimer's, and that the person who is struggling with the disease is often incapacitated and not advocating for themselves. And so we are trying to lift up the family because they're the ones figuring out how to navigate the treatment system, how to pay for it, providing housing, dealing with legal issues, all of that. So we need more resources for families as well.
Yeah. I mean, there's so many aspects of this. There's treating the people who are right now struggling with addiction. There's helping families. And then there's dealing with the systemic problems that led us to this place where doctors could be prescribing these drugs in such large quantities, where pharmaceutical companies could be basically lying about the implications of doing that and sending millions of pills into places, without throwing up a red flag saying something is going on here. So just on the treatment part, what do we know about what works best to get people who are addicted to opioids off?
Yeah, in terms of treatment for opioids, medication-assisted treatment, there are 3 FDA-approved medications for opioid addiction, and they have been proven to be the most effective. People that are on medication, just like with any other disease, you're on medication, but you also may do therapy, you might have a multimodal approach, and we want to think about addiction in the same way. And for opioid addiction, we're lucky that there are medications that really help people, because for cocaine, meth addiction, stimulant addiction, we don't have any medication, so it's a lot harder. We just need more access to those medications.
Yeah.
But what would be great is that if we could prevent this opioid addiction before it starts, and that comes in the acute pain setting with surgery. And there are all these other alternatives out there. They're just not being covered by insurance because it's cheaper to provide 40 pills than to provide an alternative.
So how does that get changed? Is that a government regulation that would require that, or is it a market? Or would it require the market to come together and lower the price?
I mean, it's 2 things. It's by increasing access, we need to reduce the barriers for insurance to cover this, and that's CMS. And we've made some progress in the ambulatory surgery centers, but not in the outpatient and hospital settings. And these are really big institutions, right? So to get them to sign on to this, it's not their fault. They're looking at the bottom line, what's going to save them money, and they're struggling too. But at the cost of addiction, more upstream, it's better to prevent and actually save money by providing these alternatives.
I've seen it compared. You're losing a Vietnam War's worth of Americans per year to the crisis, and it's only getting much worse. So it seems to me it's some sort of dramatic action, regardless of hospital bureaucracy, is probably worth pursuing. I think my main question is what is the one thing that could be done, tomorrow that would actually dramatically change, or is that just not possible? Is it such an all-encompassing, comprehensive crisis?
It's a comprehensive problem. We're not going to snap our fingers and say this can be changed and everything's going to get better. There are 200 people dying every day to an overdose. You add in the number of suicides and the mental health crisis that we have in this country. On top of that, it's close to 300 people a day. This is out of control. We need treatment access, but we also need to educate consumers to be their best advocates and to know what the options are. So that's really important as well. And this is such a stigmatized issue, and that has prevented people from getting treatment, from advocating for themselves, for getting the best care, and that's changing. We're changing the movement. People are coming out and telling their stories, and the reduction of stigma is what's going to help with insurance coverage, what's going to help with access and consumer education.
So, and a lot of funding needed for treatment too. Yes. I know you have to run because you have to get to your lunch, which we don't want to make you late for, but I do have one other question. Senator Elizabeth Warren has been sort of a leader on the Democratic side in terms of offering a big plan to deal with addiction. What do you think of the contours of her plan? Is she getting some things right there?
Yeah, I mean, the scale of the plan is absolutely right. They modeled that bill after the CARE Act, after the Ryan White AIDS bill, which approached the problem in the necessary way and the necessary scope. And we need a response like that, absolutely. I don't know if it's the perfect bill or if there is a perfect bill, but we do need to put that kind of money against it in order to see change.
The money is always the hang-up. Good luck today. Thank you so much. Thank you for coming. Thank you so much for doing this work. Truly so important.
Thank you so much.
So coming up, all your hopes of traveling back to the future may have to be put on hold.
So a new study shows that humanity might be stuck in the present. Dr. Joe Pesh tells us why as Rising continues.